Vicky, your CNA. Hi, I'm here to give you a bed bath. Okay, I'm gonna gather my equipment. I'll be right back. Sanitizing my hands, covering all surfaces until completely dry. I'm gonna need a basin, soap. It can be either liquid or bar soap. 1, 2, 3 washcloths, a towel, a clean gown, and a bath blanket. The gloves are optional. I'm going to head over to the sink and grab some comfortably warm water. Warm is that way. I don't have to wait for it to come out warm because sometimes it takes quite a while, but as long as you are getting it from the warm side of the sink, you get credit. I only need a cup or two, so that looks like a couple of cups, so that's sufficient. All right, pulling the privacy curtain. Raising the bed. To proper working height. How's your day going?
Good.
All right, so I'm going to cover you with the bath blanket. And you want to be sure you have your linen containers for your wet and your dry linens. Let's get started, Dan. We're going to put your bath blanket on, both for privacy and for warmth. I'm going to take your blankets and put them towards the foot of the bed. So, and you just fan fold the top linens to the foot of the bed. There they are. Make sure that the patient stays covered for privacy. Now we're going to take your gown off. Because the patient has to be undressed for the bath, maintaining privacy. And I'm going to take the gown off without exposing the patient and the gown, pulling it out towards the bottom of the bed, not towards the face. Okay. All right, so we're going to wash your face, your arm, hand, and underarm. We're not going to use any soap on your face. Again, gloves are optional. If you use them, you don't get any points taken away. So we're going to start with the eyes from inner to outer using a clean portion of the washcloth for every stroke. We're going to start with the left eye. Inner to outer, clean portion of the washcloth. Inner to outer, clean portion of the washcloth. Now the rest of the face. Again, no soap on the face. That's wet. I'm going to dry your face. No particular technique for drying, just simply drying. Okay, I'm going to take the same towel, or you can use another one, but I just use the same one. Put it underneath the arm to protect the bed. Expose the arm. You want to be able to have access to the underarm, to the axilla, the underarm pit. Okay. Now we're going to do wash, rinse, dry. That's my hand sanitizer. This is my soap. Wash, rinse, dry. Going to go in circular motions. Promote circulation that way. Okay, now the hand. Okay, and the last is going to be the underarm pit. Doesn't have to be last, but it's good technique to make it last because it's the most soiled area. Dispose of that washcloth. Now you're going to rinse. Same technique. I generally do the underarm pit last. Again, you do have to clean the underarm pit. It's not an option. You won't get credit if you don't clean it. The actor is required to let you clean it, and it's a step in the handbook. Okay. Arm, hand, and rinsing the underarm pit. Again, no soap on this washcloth. Dispose of your soiled washcloth. Now the same towel that you use to protect the bed, use it to dry the hand and the arm, and dry the underarm pit as well. Again, you don't have to spend a lot of time on the armpit, but you do have to demonstrate that you did clean it. Now, let's get your new gown on. How you doing, Dan?
All right. Feel clear now.
Good. All right, let's get your arm in there. Okay, make sure that the patient stays covered. So he's covered with this gown, moving the bath blanket towards the feet. Disposing of the bath blanket, covering up the patient. Okay, Dan, looks like we are done. Gonna open the privacy curtain. Here's your call light and water within reach. Gonna lower the bed. And then I'm going to head on over to the sink and empty out my basin, rinse it, dry it, and then return my equipment back to storage. Okay, Dan, you have a great rest of your day. All right, empty out my soiled water, rinse my basin. Dry it. Dispose of my paper towel and return my equipment to storage. Sanitize my hands. Just covering all surfaces. And skill complete.